All right. Good evening, and I'd like to thank you all and welcome you to the ANC3C June public meeting. So we will start with the sorry, the establishment of the quorum. So I am Janelle Pagets, 3C03, and present 3C02,
Present.
3C01.
Present.
3C08,
Present.
3C07.
Present and accounted for.
Thank you. 3C06,
Present.
3C05,
I'm here.
3C04.
Present.
Excellent. So we have 8 of 8. A quorum has been established. We will verify that we sent notice to the website, the listservs, the Twitters. If anybody, has another listserv or, wants us to also notice building listservs, whatever, please reach out to either all ANC or your ANC commissioner. You can also sign up for our newsletter, which we also notice. That link is available on our website, including on the agenda for this evening's meeting. We will move on to the approval of the agenda, which includes the meeting minutes, the approval of the May meeting minutes on the consent calendar. So if the agenda is approved, that will be approved as the item on consent. Do any commissioners have any items they would like to add to the agenda or change on the agenda? All those in favor of approving the agenda, say aye or raise your hand. All right, that is everyone. So the agenda is approved. Thank you, including the May meeting minutes. We will start with announcements from the single member district or single member district reports. I will start by saying I'm sorry that the zoo tour bus, we had a meeting and walkthrough scheduled for the Thursday that it was poor air quality conditions. So unfortunately, we had to cancel that meeting. It has since been tentatively rescheduled for the first week of July. It will be a walkthrough with the director of the zoo and staff members from the zoo, along with DPW and DDOT and myself, and a member of the council member's office. And we look forward to, in the July meeting, coming or presenting solutions to the community that we plan on implementing moving forward with the zoo tour bus situation. And does anyone else have a single member district report and would like to go next? Commissioner Prinzo.
Thank you. I have 2 things quickly. First, the Wardman is 99.97% down at this point. You will notice that there is a large increase in trucks in the area. They are taking away the debris, so please just be mindful of that. They do have flaggers on, I've seen them on Calvert Street, I've seen them on 24th Street over by the Metro stop, and I believe I've seen them on Woodley Road, but I cannot place them there in my mind just yet. But they are there for your safety, so if they're telling you to stop, please stop and don't walk around them. And my second one is I'd like to give a special shout out to a 3CO2 resident who is not able to join us today, but Miss Judy Mabone of 3CO2 was recently crowned the 2023 Miss District of Columbia. So she will be going on to represent DC at the national level. And just quickly about Judy, who we affectionately call Jude in our building, she survived her first heart attack at the age of, I believe it was 14. She was diagnosed with heart disease at the age of 16, and she's been a very vocal advocate for adolescent and pediatric cardiology And she also is a weekly volunteer at Children's National Hospital. So let's all wish her good luck. And that's all for me.
That is amazing. Thank you. Commissioner Siddiqui.
I'm a hand up, but I can't follow that. We should pass a resolution in honor of Jude, or at least like something that like says that we support her. I mean, sorry, I'm giving you more work, Commissioner Prinzo, but that is such a great way to start a meeting.
That's fine.
All right, it's downer time. So construction keeps popping up in 3C05. Lately there's construction on Porter Street. I was not notified of what it was. Couldn't find out what it was. I got two different pieces of information. Someone says it's Pepco, someone says it's Washington Gas. Again, no residents were given notice. And what I've found so far is it's one or the two of them. And apparently utilities can schedule this stuff if they deem it emergency and not notify anyone. So my apologies, I'm still trying to figure out exactly which work is going on where. And I know there's some emails out about it, but I will let everyone know once I figure it out.
Thank you. Commissioner Kripke.
Hi, yeah, a few small things from me. Number one, just to give warning to the neighborhood that there's about to be a bunch of construction at Cleveland and 32nd Streets, July and August. It's a 10 to 12 week project that'll be digging up the streets there and changing gas lines. And they expect to have traffic dislocations. So just be aware and maybe avoid it if you're in a rush. I want to announce that there were speed humps put in on Cathedral or Woodley, whatever's in front of the Murray School 2 weeks ago, which I have to say was a surprise, but a welcome surprise. So we have some traffic calming in front of the Murray School, which is on I think it's called Cathedral, or maybe it's called Woodley at that block. But it's good and welcome, although again, I didn't know what was happening. And the last thing is, I've talked to Commissioner Siddiqui about this, but I just want to say here that I have some neighbors who are interested in doing a traffic safety investigation for Garfield Street. They're complaining about traffic down there. So I'm going to be pursuing that with Commissioner Siddiqui in the coming weeks and months. I think that's all to announce from me.
Great. Thank you. Anyone else want to provide a single member district report? Okay, just an overall commission report. DDOT will be scheduling a meeting regarding the Taft Bridge design options in either July or August, which we will notice in our usual fashion, and it will be open to the public. So just don't know exactly the timing on that, but it is coming up. So just wanted to make the community aware. Thank you. Alrighty. Next up, our committee report is Commissioner Siddiqui. You're up first with safe, sustainable transportation and equitable transportation.
Since we did not have a committee meeting in June, we do have a confirmed meeting July 2nd at 7 p.m. There's lots on the agenda. There's a discussion. There's lots of neighbors reaching out about road safety around the neighborhood. The first item is discussion of Lowell Street, close to Eaton School, sort of road safety around there. That really impacts children, but also people in the neighborhood as well. There's been a lot of emails about Porter Street Northwest and Connecticut Avenue Northwest intersection. Even now that it's redone, the light timing still seems not enough, and there's a lot of confusion happening at that intersection. If like signs aren't completely there, lots of cars blazing past, left turns when they're not supposed to. So we're gonna have a discussion about that. There's also, as Commissioner Kripke mentioned, a discussion on Garfield Street Northwest safety as well. On the agenda, we also have a discussion on road safety, traffic calming on 34th Street Northwest, Reno Road Northwest. And then the other holdover from previous meetings is bike share stations close to CP Metro and Klingel Road Northwest.
Great, thank you. And that meeting will be on July 12th, correct?
Yeah.
Yes. And I'm putting the link in the chat.
Excellent, thank you. Okay, transparency and public process.
Nothing from us.
Alrighty, community engagement and grants.
Hi, yes, I'm probably a little late in notifying this, but we do have a grant application that's come in. And so I would like to convene a meeting, which would be for next Tuesday. And I'll send details and hopefully we can notify everyone about that, including information about the grant application. So I just want to say that. Otherwise, we didn't have a meeting last month and we didn't have anything on our docket.
Okay, great, thank you. Planning, zoning, housing, and economic development. So we actually have 2 nominations for new members to the committee from the public. So Commissioner Prinzo, I'll let you introduce Glenn Kellogg out of your SMD first.
Thank you. So for 3CO2, I would like to nominate Mr. Glenn Kellogg to the Planning, Zoning, Housing, and Economic Development Committee. I believe he is here, so he can unmute himself if you would like.
Hey there.
And if you'd like to say a few words, or totally up to you.
Hi, I'd love to join. I already work with Cassandra in the Cleveland Park Main Street as a advisory committee member, and I'd love to join this organization as well. My background is in planning and economic development. Mostly I work around the country doing urban economics around downtown master plans, comprehensive plans, and things like that. And I usually put numbers and analysis behind it.
Great. So I would like, do we move it together or can I just move it now?
You can move it and then
Okay.
in a second.
I would like to move this nomination.
Second.
All right, so the vote is on Glenn Kellogg joining the Planning, Zoning, and Housing and Economic Development Committee. All those in favor, raise your hand or say aye. All right, all 8 hands are up. So all those opposed, there are none. The motion carries. Welcome to the committee, and we look forward to working with you on this. Next up, I'm nominating my neighbor, Kathy Gibbons, to the committee as well. So Kathy, you are here and you're unmuted. So if you'd like to introduce yourself and say a few words, that would be great, and I'd appreciate it. Thank you.
Hi, everyone. I'm Kathy Gibbons, and thank you to Commissioner Pagets for forwarding my request to join the committee. I am a longtime DC resident. I've been in Cleveland Park for 6 years, but I've been living off of Connecticut Avenue for more decades than you can count, and been aware of Cleveland Park and a participant in activities here for many years. By training, I'm a lawyer, and I have worked in housing finance for many years. And when I gave up that gig, which included Fannie Mae, the Mortgage Bankers Association, the Big Four, Ginnie Mae, et cetera, I became more interested in what's happening in local politics, and I must say, I did not expect the black swan event of the pandemic that has changed everything, or just accelerated everything. But we have a lot of issues, and I think they're extremely interesting. I don't come from any particular theology on them, and I've just found it a real pleasure to work with the members of the ANC with whom I've worked. I think we really need the services of the ANC to connect us with city government, and I think whatever it is that the city's doing, at the very least, whatever our opinions are on it, we deserve transparency and process. And I've seen this ANC take some real leadership on some of the some of the resolutions that I've had an opportunity to work on. You all are so open to input. Thank you.
Thank you. So I move the nomination forward of Kathy Gibbons to Planning, Zoning, Housing and Economic Development Committee.
Second.
All right, thank you. The vote is on the nomination of Kathy Gibbons to Planning, Zoning, Housing and Economic Development Committee. All those in favor, raise your hand or say aye. All right, I'm seeing all 8. All those opposed? There are none left. So welcome, Kathy. The motion passes. You're part of the committee now too. I'm very excited to have you. And both of you are bringing like so much talent and energy, and I'm thrilled. So thank you.
Thank you.
Awesome.
Yeah, I'll quickly just say, like, I think it's so wonderful whenever anyone joins the committee, but the fact that both of you have already done so much for the neighborhood, I mean, it's so much more heartening that you know you're joining. So thank you so much for everything you're done and everything you're going to do now. So
Yeah, now we're going to give you all the recognition, and with that comes responsibility. So great, thank you. So our next Planning, Zoning, Housing and Economic Development Committee meeting is going to be Monday, July 10th online at 6:30. And we have already asked folks from the Building Innovation Hub to come and speak about building energy performance standards, otherwise known as BEPS, an overview of that, and especially relative to the requirements of multifamily buildings, because the compliance cycle is starting, and we've heard from the community that this is something that they're interested in learning more about. So we're hoping to, get notices out to these multifamily building owners, especially so that they can send a representative as well. And then Commissioner Gordon, were we going to have the liquor license that's in your SMD discussed at the next one too?
I think we should. I just need to get confirmation that they can join us, but yeah, I'll reach out.
Great. So yeah, when we noticed that there is an ABRA or whatever the agency is called now, application in the old California tortilla spot that's been placarded. So
I think I messaged her on just like whatever online, but I think they were out of town, so I just need to follow back up.
Okay, great. So do you have anything else, Commissioner Gordon, okay, thank you.
No, just all the things everyone else has on construction.
All right, residential historic preservation.
Thanks very much, Chair Pagets. Although the HPRB docket has been fairly busy of late, major applications on residential historic preservation have been quiet in our ANC lately. However, I'm aware of at least 2 and possibly 3 applications that are now winding their way through HPO and are likely to come before the committee and then the ANC in the next couple of months.
Okay, great. Thank you. All right. Environmental justice.
Thank you, Chair Pagets. Yes, we had our second Environmental Justice Committee meeting last Monday, the 12th, with Rachel Manning from the Department of Public Works about composting. I think it was a good discussion, a good presentation from Rachel. Given the points we made and that came up, I think it would be worthwhile to draft a resolution kind of addressing some of the points that were important to us in the community, including compost collection for multifamily buildings. We can give our support to the pilot program, but encourage something similar for apartment residents. And so I've only had informal conversations as follow-ups with a couple of the committee members. But if that sounds like something we should pursue, I can draft something hopefully for our next meeting. And we can take some action as a follow-up to that.
That would be great. And thank you. I thought it was quite informative too. So
Yeah, it was good. I think that Rachel did a good job of presenting in like an official capacity, and but like I said, I thought the feedback from the community was excellent. We had some new voices there too. So yeah, hopefully and we can encourage more discussion about that in the future. I also have on the list to set up, I guess it'll be for the second half of the year at this point, but just to schedule in advance which dates we would meet, and kind of like the other committees do now that we have a couple of members and a little momentum behind us. We can get that squared away.
great. Thank you.
Thank you.
All right, that concludes our committee reports. So we have a very special guest with us tonight, Anthony Hall, who's the director of the community response team with the Department of Behavioral Health. So I will allow him to introduce himself and then go through his presentation. And this was a direct result of what we were hearing about community concerns and questions about, you know, how and who to reach out to. So Mr. Hall, the floor is yours, and thank you again.
No problem. Thanks so much for having me. For the familiar with your faces, I know some of this will be old hat, but always happy to answer questions. So first, just for clarification, I'm actually Director of Public Engagement for the agency. I was the founding director of CRT. So no sweat, it gets confused all the time, all over the city. So no worries at all. But I'm definitely able to speak on the program that I designed, so I can let y'all know what you need to know about them. Just a little bit of background on the department as a whole. So one of the things unique to DC's Department of Behavioral Health is that we function as both the State Behavioral Health Authority and the Local Behavioral Health Authority, which just like everything else makes us sit very uniquely in the district. We are responsible for the oversight of the entire public behavioral health system. So that being our 53 contracted core service agencies, those are the entities responsible for direct care of anybody in the public behavioral health system. So those are case management services, psychiatrists, therapists, community support workers, the whole nine. Those are operated under the umbrella of core service agencies. We operate a forensic services division under that same umbrella, and those are the individuals tasked with supporting the court system, overseeing the forensic beds at St. Elizabeth's Hospital when individuals are either being stabilized for competency restoration or have been determined to be NGRI and are being maintained in the hospital until such time as they are deemed safe to return to the community. That team also supports all of our initiatives with entities like CSOSA, our returning citizens initiatives, and things of that nature with direct care. We have our school-based mental health programs. So all early intervention programs, we put clinicians in, well, we're supposed to be putting clinicians in every school within the district, every public school. Everybody's familiar with the workforce shortages that are being discussed, but that makes DC incredibly unique as a jurisdiction to have the commitment to want to be 100% present in school. So a combination of actual DBH staff clinicians and contract clinicians fulfill those roles. A big space in what we do is the administration of grants to provide direct care service. So right now, the State Opioid Response Grant is probably the biggest grant that we're administering, and that is addressing all of our opioid outreach needs. It set up the local prevention centers, which are targeted at supporting youth who are honestly keeping youth away from substance use, providing education. We support a number of the citywide tabling events, things like that under that umbrella, as well as operating all of our centers, our peer-run centers, and our community education programs. We do have a learning institute, which is free for district residents to enroll in behavioral health education classes, things like mental health first aid, which is very popular. There are a number of other signs and symptoms, Wellness Wednesday, kind of the whole nine. So there's those are courses that are certified that people can take. District residents can attend most of them for free. Those who have professional licenses can also get their CEUs by utilizing those, but those are a lot of fun and it's kind of a unique space. We have our peer run centers and our peer certification program. So individuals with lived experience being able to achieve certification, which ultimately results in improving our behavioral health system, because now we have individuals performing the duties and the services that have knowledge and a unique perspective, which is national best practice. And we really have seen it improve our overall ability to deliver services and support. So that is kind of the broad scope of the department as the authority. Then the department as the LBHA is where we get all of our safety net programming. And that's kind of what those are the boots on the ground programs that most people are familiar with. So we have our comprehensive psychiatric emergency program that is our 24/7 psych emergency room in the city, located on the grounds of DC General. Often they are referenced when people are taken involuntarily to be evaluated, but in addition, it is a 24-hour psych emergency room. So you don't have to be involuntarily committed in order to go there. Anybody who needs medications, who needs to see a clinician is capable of going there. At 35 K Street, we have our urgent care clinic. Same as any urgent care clinic, people can walk in and get evaluations or medication screenings. If there's for some whatever reason been a gap in their ability to receive their scripts, they can get those filled over at 35K. Also, if somebody does not have benefits and doesn't really understand how that system works, they have counselors who will support them through the application process and help them get enrolled in the public services system. We have the mental health hotline that is free to any district resident. You can get up to six free sessions with a clinician. They can also support you in linkage to a provider of your choice if you work with them in that way. That is also the place where that's the number that connects to 988. So for anyone who is interested in utilizing 988 services, you might be aware that there are geofencing issues with 988 right now. So your 988 call goes to wherever your area code is linked to, not where you are geographically located. So we also have the 1-888 number, which you can utilize and actually be talking to DC-based services. And I've already forwarded those electronic flyers to you, Commissioner, so you can distribute those as you like. And CRT is probably the program that most are familiar with. That's our 24/7, 365 direct care arm for the department. So CRT is responsible for the psychiatric evaluations. They do write a lot of the orders for involuntary evaluation in the city. They're also the clinical teams that go out following a lot of traumatic events to provide direct care services to communities. They do a ton of linkage services. They're the outreach teams. You'll often see them during inclement weather, doing 24-hour evaluations of individuals, again, to make sure that people are safe and provide protective services in that way. They are responsible for all of our joint and co-response with fire and EMS, pretty much everybody in our public safety and justice sphere. So at any point, an officer can call and request a joint response, and it'll be CRT who is going to go out with them. And just kind of a quick carve out, we do, as a department, train members of the Metropolitan Police Department. So if you've ever heard the term CIO, Crisis Intervention Officer, those are officers that we've specially trained on how to deal with behavioral health crisis services and situations. So oftentimes, if a team is contacted and it sounds like it's emergent, we'll advise individuals that we're going to call 911, and they'll hear that term utilized. And so just so you know, there are officers who have been specially trained in behavioral health, and that is an expanding space where we are working with MPD. Yeah, so in a nutshell, this is the umbrella. Like, it's much bigger, but I know that there's often a lot of questions specifically to CRT, kind of how programs function, and to the larger system, like how the pieces work. So I am happy to answer any additional questions that you all might have.
Great, thank you so much. So commissioners, I'm trying to put the numbers in the chat. Do you all have any questions? Commissioner Siddiqui.
Thank you. I mean, that is incredibly extensive. I am amazed that you remember all. I mean, I guess you built it, right? So you that is such impressive work on such, and I guess I have like kind of one, a broad question, and then I'll let other commissioners go, and then I'll come back maybe
Mhm.
with specific ones. But it's like there's so many resources there, and also thank you for the electronic resources. I just got them, and I've updated the agenda. So for anyone in the public who would like to look at them, they're on the agenda now. And those are also helpful. But you do such a wide variety of work. Like what is, and even us as commissioners don't know this, and that's why you're here, kind of telling us. What are some ways what is the easiest way for us to navigate to like the right resource that you all provide, right? Like given a situation or something. How do we find that? Like, I know these these two resources that we just put on our webpage, they're there. Do you suggest like there's a central number we always call, the central website? Like, what would you suggest for us, like taking advantage of the spectrum of things you do? And I guess the second question is related to this, is how can the commission propagate this to the community as well about what you all do?
Sure. So if we're talking about kind of a direct service intervention sort of thing, it's going to be one of those two numbers because they work interchangeably in terms of connection to the larger behavioral health system, a response, or something of that nature. If it is more community education oriented, it actually comes through my office and I disseminate it across my whole job now is to kind of connect the dots to make sure that the right resource is getting to folks, because we recognize it is incredibly confusing and you're not going to know the 55 different program managers, and nor do we expect you to. So funneling those to me, then I'll be able to get you to the appropriate spot or connect you with one of the members of my team who will then kind of shepherd that process along to make sure that folks are getting where they need to be. Again, that's separate from kind of an urgent psychiatric emergency or we've got a concern for somebody. Those go to those two numbers that were forwarded.
My colleagues allow me, maybe can I do a quick follow-up about, you said community education. So like, are you talking about, for example, you could do a program at our library where community members can attend and like learn more about stuff, or like what
Yep.
kind of stuff do you envision with something like that?
Yeah, I mean, for example, I will be supporting the Southwest bid in 3 weeks to talk about just active stress response and management. I do a lot of work around education about vicarious trauma and recognizing signs and symptoms of stress-related illness, things like that. So there's a wide berth of clinicians that exist within DVH, and it's kind of, if there are ideas for those sorts of forums, we're happy to support either it being us or we have a number of CBOs that we work with who are kind of either grant funded to provide these sorts of educational engagements and things like that, and we'll connect the dots there.
Thanks. That's awesome. I also didn't realize that we did the training program for folks to get their licenses after they've experienced a similar situation. I think that's great. I've heard of it being done in a number of other cities, so it's really good to know that we're doing that as well. Any other commissioners have any other questions? Comments? Commissioner Siddiqui, did you have more, or should we go to the community?
Maybe I'll ask a couple more and then we can go to the community. I have neighbors who are, oh, Commissioner Kripke, please go ahead.
Oh, well, I didn't want to interrupt at all. Can you please finish your thought and then I'll come in?
Okay, thank you. Like I have, often neighbors, especially like post-pandemic and stuff, who reach out to me and they tell me that they have long-term mental health and behavioral health issues, and they really are seeking help. And oftentimes, sometimes I do ask them if they're connected to someone, like do they have a behavioral health officer and stuff. And sometimes they say yes, sometimes they say no, but then they always say that they're worried about, just how they're going to cope in the long run in terms of their job and like where they live and things like that. What's kind of more of that long term? I know for the kind of short term, you said, one of the two phone numbers, depending on what's going on, but for this more long term thing, how can we help, a neighbor, commissioners help, or anyone in the community help neighbors who approach us and say that they're having issues like that?
So that would actually be where you'd really want to point them to the mental health hotline, which would then help them get linked to a community-based provider. And that's where that ongoing care and support would come from. Like that's where your face-to-face therapeutic visits, your community psychiatrists, things like that, both within the public sphere, but then they can also work with individuals who have private insurance, things like that, to understand their benefit, and more importantly, to understand the larger system, because there's the behavioral health services that operate under the public system, but then, I'm an independently licensed clinician, so I can provide services in the district that don't fall under the umbrella of DBH. And often people that doesn't necessarily register, or they don't have an understanding that there's a large universe of services that we can help at least talk through and explain and offer options. Because what we also hear a lot is frustration for feeling like there are limited resources. And that's just because sometimes it's hard to understand and navigate, and especially if you are not necessarily feeling that well. Just like anything else, if I don't feel well, it's also hard for me to take in and retain and process information, because I'm just trying to make it through the day. So that would be where we absolutely encourage kind of utilizing some of these services.
Thank you.
Thank you. Commissioner Kripke.
Okay, well, okay, I'm going to say something kind of provocative here, and it's probably just to get a reaction and a response. But there's a debate in some of our neighborhoods here about residents that are using vouchers to move into buildings, and the complaint is that they are being placed into housing but without supporting services, and I don't know how valid that is, and I don't live in a multifamily building, so it's really not my lived experience. But I'm hearing this argument from neighbors and on community lists and stuff, and I would be curious for your
I'm sorry, I lost the commissioner. Did everyone
Yeah,
else?
you're breaking.
people
up.
have frozen, so I'm worried I'm not being fit, or feel like there are constraints on your side. Well, I'm interested in our guest's reaction to that criticism, and whether he agrees with it or disagrees with it. Feels like he's constrained in some way, or has mismatches with other programs. I'm interested in hearing his reaction to that complaint.
Okay, so you did freeze, but I'm going to summarize and just let me know if I basically categorize it. So the perception that individuals with vouchers are being placed in buildings without adequate support resources, thus causing concerns and conflict within new communities. Is that fair or an apt description?
Yes, that's the complaint, and I'm interested in your response, whether you think it's true or not true, or whether it's true because of certain. Or I'm just interested in your response on that.
So I don't think that it's true. I actually think what tends to happen, and I'll step back a bit, the term voucher is used as a blanket statement. However, there are multiple types of vouchers that individuals receive to get housing placements. There are multiple vouchers under multiple entities. What the narrative that is often very unfortunately circulated is one that is true of 30 to 40 years ago, when they were clearing out the hospitals due to the decision to deinstitutionalize. Then a lot of people were placed into communities without supports. The infrastructure just wasn't there. And that narrative has continued forward. However, we are looking now at vouchers from DCHA are in no way tied to someone having any relation to the behavioral health system. They're not tied to any diagnostic presentation or illness. The same for coming from DHS, where you might be coming from the homeless services system, but that does not in and of itself mean that you have a diagnosed mental illness. And so just to address that, because voucher, like caseworker, are often used as blanket terms, and folks don't realize there are multiple types of caseworkers. So you could absolutely have a behavioral health caseworker, but you could have a housing caseworker. You could have a Department of Health caseworker, everybody functioning. That is where the wraparound service comes from, but everybody has a part to play in that process. And I think what gets assumed is when somebody says there's a conflict and I haven't seen my caseworker, there's an assumption that this is tied to a behavioral health issue. So that's where I don't think that the narrative is necessarily accurate. There's also, unfortunately, the belief that your housing is tied to engagement with a health service. And that's simply not the case. We operate under the Housing First model, which is national best practice. And that means that the approach is, in fact, housing first, and it's not tied to your compliance with any other sort of service, because at that point, care is treated like it's a carrot and stick sort of thing, rather than giving individuals the dignity of having a stable location to then begin to work on some of the other social determinants of health. So just to kind of flag that. I believe that there are individuals who might need extra supports, and that is where pinging some of these resources comes into play, kind of flagging, because if it's not, say our CRT goes out and the individual is just frustrated and having a conflict with their neighbor, or they are stressed because they haven't been able to reach out to their DHS caseworker, we'll reach across to our sister agencies and kind of connect those dots, and vice versa. So that happens fairly frequently. What we do encounter a lot of is that because there is a narrative, we see a lot of individuals having police called on them multiple times, a lot of complaints lodged against them, which creates a sense of frustration. And then our past clinical director kind of framed it best. The clash of culture results in oftentimes an inability to treat one another with civility, because I am now on guard and I am triggered by virtue of feeling like I am being targeted in this space, where the next person is concerned because perhaps my behaviors are unusual and they are different. Perhaps I do have something going on, but it prevents us from hearing one another. And so I think to that point, it's not an uncommon conversation that gets brought up, but I think there's a lot of nuance to it. But the narrative that people are just being placed here and dropped, that's just not accurate. So we've specifically in 3, I've worked with a number of the apartment buildings, kind of the property managers, made sure they had the numbers. And in the last public safety meeting I was in, there was a lot of discussion about those numbers being used, and to decent success. So I was excited to hear that. And, I'd be happy to talk to and kind of explain the resource and also the limitations. But as situations arise, we still encourage, go ahead and give us a call, because again, it's our job to untie the knot, not to burden the community with trying to figure it out in order to try to be the clinician in the room for another person. So, just let us know and we'll conduct the assessment and kind of go from there. But I hope that answered your question, because the wraparound services are absolutely available. No services in the district are mandated unless they are truly court ordered or you are committed to the department. And again, that's by virtue of a court related situation. So there's no requirement that you be engaged in service. And I think that gets lost quite a bit as well.
Thanks for that response.
Mm-hmm.
Thank you. And I'm
Sure.
really glad that you're able to address that false narrative that I think we all need to take responsibility to push back on that when we hear it, and make known that these other resources are available, and it shouldn't just be, and some people are just having a bad day. So understand that, be empathetic and be sympathetic to your neighbors, and MPD isn't the response to everything. There are other resources available, and just, don't make assumptions. So thank you. Commissioner Frinzo.
Thank you, and thank you for that. I just had more of a technical question. You mentioned that if somebody were to call that number, it is tied to their area code. So like if someone calls and they're here, but they get connected to the people in New York, like, can they transfer you to somebody in the district, or would you have to call? Okay.
It does depend on how well established the so
Right.
some of the PSAPs are really good and they kind of have interconnectivity. Others are being stood up or kind of doing overflow work. So it gets a little bit funky, and oftentimes they'll literally just Google the number and call and connect a person that way, versus kind of the seamless technological transfers we wish would happen. But yes, they'll get you to where you need to be.
Okay. And then are they working? I don't know if you would know this, but are they working to fix that? So like it would dial perfect. That's all.
Yeah,
I
the
had. Thank
geofencing
you.
issue's been pinged. I think that the most recent estimates is we're probably still about 8 to 12 months away from it really being refined and fixed. They knew it was going to happen when it was brought online, but it's kind of just where we ended up to get the new 3 digits out there.
Right. Thank you.
Mhm.
Thank you. I'm glad that you cleared that up because I think that was actually a complaint I had seen on the internet about using that number. So
Yep.
we're all aware and it's in process of being fixed. Okay. Any other commissioners before we open it up to the community? Commissioner Siddiqui?
I'll do one more. So when in issues involving violence, at what point do we switch from number to MPD? Do you have a recommendation for that spectrum, or is it just try and call your number whenever possible?
So if there is active violence occurring, violence with injury, anything like that, we recommend contacting emergency services first. Again, to just easiest way, we come in a minivan, they come with lights and sirens. So the reality is that getting there when time is of the essence, it is always going to be them. They can reach back, they'll do a telephone consult, they'll secure the scene until we arrive. Like there are a lot of different options, or you can request that CIO if you think like it's a complicated situation.
So sorry, so maybe I misunderstood the answer. So call the emergency response number. You're the one that's on your flyer.
If active violence is happening, if it's
Yeah.
if it's emergent, time is of the essence, call 911. Yep.
Call 911. Okay.
Everything else is us. Yep.
Everything. Okay. Thank you.
Okay, thank you.
Mhm.
Okay. Let's open it up to any community questions. Just use the little raise your hand feature under the reactions or turn on your video and raise your hand and we'll call on you. You can also send message in the chat, which the co-hosts get. So there's that option too. Kathy?
Thank you, and Mr. Hall, thank you very much for being with us. And you and I have been on other calls, recently that with property managers in which they have described the one person recently said, almost on an every other day basis, kind of psychiatric meltdown in the building. And people have, of course, in the neighborhood noted the uptick in police car activity. And this is discussed by neighbors, by folks who overlook certain buildings, by businesses that are across from them. It is apparent that some people have difficulty living in a multifamily community. And this has coincided with an increased number of subsidized tenants. You are totally so right, and we every time have to avoid the generalization with regard to who is a subsidized tenant and why and what and so forth, and give everybody, most of the time there is no problem, but where there is the hammer guy or the knife lady or the shopping cart lady who walks in the street and so forth, and people in the neighborhood know it is a difficult situation. I have met with people who provide casework to the district, and it is pretty well known to them which organizations actually see their clients and which ones kind of are happy when they don't answer the phone or don't answer the door. And I imagine that's known to you too. So my first question is, do you track the number of actual meetings that caseworkers hold with their clients, as well as efforts to make contact that did not occur? Because
So yes, as a part of our oversight in the authority function, in order to maintain their status within the network, there is they just recently rebranded, but it's basically our it's our audit arm, and I forget what their new title is, but they are the ones who, when complaints come up, they go through our ombudsman's office, and then they are connected. They'll do review of case notes, case status, things like that. And just also if there are individuals who there's been a change in their presentation, because there are various types of treatment providers. There's behavioral health is a spectrum. So on one end of the scale, you do have kind of the clients that you just check in with, and there are agencies who that is theirs and it's very low acuity. Then there's the highest acuity, which is assertive community treatment. Those are programs that basically are one-stop shops. They see their clients multiple, and at some points 7 days a week. I used to oversee an ACT team where a lot of our clients we saw twice a week, every day of the week. So there's a wide spectrum there, and we have oversight of all of that. And when we start to see those changes, those individuals who are cycling through the hospital, then it kind of triggers an internal process where there's a review of, is this person now connected to the appropriate level of care, or does that need to be escalated? And so that's also where we encourage, make us aware, because if like our CRT, if our mental health hotline is getting reports of these cases prior to it being multiple hospitalizations, multiple encounters with MPD, and sometimes it's going to happen hand in hand. Unfortunately, it's just kind of the nature of the beast. But if we have that information ahead of time, we can make a change in terms of the level of care that somebody is receiving. And maybe we need to right size things, because stuff happens, new events, our baselines change, and we need to adjust as such.
That's excellent. Thank you. There was a Robert White, comment recently that he is looking at asking, property owners with more than a certain percentage of voucher tenants. That was how he described it in their buildings. To to put aside one unit. And it's for caseworker use, so that they wouldn't have trouble with missing people and no cell phone connection. Any reaction? That's it from me.
I just want to jump in quickly and just remind of what Mr. Hall said earlier about the district does not tie housing to like healthcare requirements. So again, I'll let Mr. Hall speak further to this and answer the question, but I think that narrative we really need to get away from. It's not a carrot stick thing, right?
Yes,
Correct. But housing first tenants do say wraparound service. I mean, if you call yourself a housing first city, that's part of it.
Well, and I'd like to acknowledge, like, there are a number of buildings who have taken that approach, and it is incredibly helpful, just in terms of providing a space. We know some programs who they will set up and it'll be their day, and they will kind of work through who they know and have there. And again, it's not just behavioral health, but it creates convenience. It often for individuals who don't necessarily have the same financial resources, and it can be a burden to access services sometimes, it makes the process a bit easier. So like as an overall and general idea, yeah, I'm a community social worker. So at any time where you say you're going to make it easier for my clients to get in touch with any service they need, I'm going to say I'm all for it.
Okay. Thank you.
Mhm.
Other questions from the community? So I just wanted to bring up when we had talked yesterday prior to this call, you made a really profound comment about we can't just be having these meetings where we're talking about people. We need to bring people into the conversation and not continue this kind of behavior. If you want to speak more to that or have any ideas for the community in this group as to how we can facilitate that, I think there are a lot of folks that would be really interested in having that happen. Myself
Sure.
included.
Sure. Like I've found it very interesting. A lot of conversations pop up when we talk about individuals who are considered to be problematic neighbors. But again, it's this wide umbrella, but you notice there's really a distinction. I go to a lot of ANC meetings, so I know getting people out in general can kind of be work. And so respect to everybody who's here, and respect to the commissioners who are doing a great job to get people to attend. But what you also hear is like sometimes the property managers talk about feeling strained because individuals are coming to them and kind of venting about the challenges they are having with the neighbors who do attend these meetings. And it's because they don't feel that they are part of the community. Like they recognize that they have been singled out as different and not a part of. And again, I think there are multiple ways to go about just inviting folks to be a part of conversation. But I think it's very important because when you realize people are talking about you, it does also cause you to recoil a bit from being able to engage. We had, for example, we had an individual who became known to our system because the assumption was he had a behavioral health issue. Neighbor kept calling the police on him because he was smoking marijuana and would play music loudly, but not to the point where it was illegal. Tons of police calls to the point where he cussed out the police. So the referral to DBH because, of course, there must be something wrong with you because you cussed out the police and told them, leave me alone. Well, there was nothing wrong with this person except they were incredibly frustrated because they knew they became the collective they. I live here. I'm not supposed to live here. But nobody had bothered to talk to this person and just say, hey, would you be willing to turn the music down? Hey, I have a breathing issue. Could we figure this out? And that's kind of what I want to highlight because, again, that voucher assumption, then people assume, then it becomes a conversation about folks with mental illness are scary. By the numbers, folks with mental illness are far more likely to be the victims of a crime than actually commit a crime themselves, especially a violent act. But we are neighbors without being neighbors, and sometimes that just gets really lost. Like, I would imagine a number of you are engaging with folks every day who have some sort of behavioral health issue that you know nothing about, or that perhaps you do, and you still have lovely relationships. And I think that, unfortunately, that concept of the voucher has drawn a line in the sand. And so folks don't even feel like they're allowed to come to these meetings, which we have heard said to us. So that's kind of the piece that I was talking to the commissioner about is folks know they're being talked about and very rarely do they feel like they are being talked to, or they're only being talked to in kind of a punitive way where it's, I have a key just like you, so why can't we talk like we're on the same level sort of thing. So again, not suggesting that anyone here does this, but more, being cognizant of the fact that you often have, and this is where I will say, you're often dealing with folks who have been incredibly marginalized, and it is not easy to navigate the system of public benefits at all. There are a lot of fits and starts, and there are a lot of indignities that come along with that. So the success of being able to have your space and then feel like your space is not your space, that kind of gives you a bit of a rub when I've been waiting 10 years to get a key. So that's just, that was the crux of the conversation, because I think a good amount of conflict can be avoided just in terms of that space.
Totally agree. And yes, I think it's so important to have the empathy and sympathy with others. There's a myriad of reasons that people end up housing insecure in this country. And Matthew Desmond and the Eviction Lab has done work on this. I don't know if anybody went to the Building Museum exhibit a few years ago on evicted. I highly recommend understanding what folks are going through when they are housing insecure and all of the other effects that it has going on. It will really change your perspective. And if you aren't already in that school, and it's just so challenging to navigate the system. So I'm so happy that you were able to help us, hopefully help others, and provide a greater understanding to the community here. So does anyone have any last burning questions, thoughts? Again, thank you so much. Really appreciate, and we'll put this information on our website and share in our newsletter and networks too. So
Thank you again. Thank you so much for your time. Definitely happy to participate. And anyone, please feel free to reach out. Email's always better because I'm at a lot of these, so I'll just be very honest with you, but happy to answer any questions and support any way we can.
appreciate it. Thank you.
All right, y'all take care.
You too. Bye-bye. All right. We will now move on to community forum, where members of the public are invited to ask questions or raise concerns about issues that are not otherwise on this agenda. Please limit time to 1 minute. Raise your virtual hand, real hand, any kind of hands. All right, seeing none. We will move on to commission business. Commissioner Siddiqui, do we have a treasurer's report? Oh, sorry, I see Matthew Barclay has raised his hand.
Hello, everyone. How are you today?
Good.
Some announcements for the week. Tomorrow, Mayor Bowser will be celebrating the topping out of the Cedar Hill Regional Medical Center at St. Elizabeth East Campus. This is a big promise kept. And so tomorrow at 11 a.m., 1200 Pecan Street Southeast, she'll be providing updates and remarks on this Ward 8 hospital being built. Also, today we did at 11 a.m. today, we did a launch, summer camp launch in Ward 4, and you can check all the programs. There's like 13,000 program or opportunities to be a part of summer camps. So you can go to dprsummercamp.com. And then last week there was some big events that happened. There was a large retail ribbon cutting at Sycamore and Oak, and a press conference about the McMillan Redevelopment Center, where there'll be a really big community center and park. So those are some big things happening in the city. We're also hiring, so you can go to careers.dc.gov and mota.dc.gov. And I think that's all we have for today. Thank you, guys.
Great. Thank you. I love that Sycamore and Oak project. When
It's
do we
beautiful
know?
too.
Adage, it's a mass timber pavilion building. It's beautiful. Do we know when the stores are going to be open in there yet?
I'm pretty I don't know.
I didn't know that they were grand opening that part yet.
It was my understanding that they were open because there was an event this last weekend there, and people were shopping.
Cool.
So I think that they're open.
Maybe I was just looking at the Sterl architectural photos then. So, but it's a really cool spot. I highly recommend folks go and check it out.
Mass timber is the future.
It really is. All right, cool. Thank you so much. All right. Now we will move on to the treasurer's report. Commissioner Siddiqui, where'd you go? There you are.
Treasurer is very happy that there is no report.
All right. Cool. All right. With that, is there a motion to adjourn this meeting?
Motion to adjourn.
Second?
Second.
All those in favor? It's everyone. All those opposed, no one. Thank you. We'll see you all throughout the next month at different meetings, and keep everyone posted on everything. Have a good evening and happy first day of summer. Thank you.
Thanks all. Bye.